Welcome, everybody. Welcome to Eye Care and You webinar 25, where we'll be learning about what ultraviolet light is and getting the best out of our sunglasses and learning and finding out which ones are best for us in different lighting and for our eye conditions. I'm Bhavini McConnor, Campaigns and Projects Manager at the Thomas Parkinson Trust, and I'll be hosting today's webinar. And our guest today is Preeti Singla, who will be introducing herself and works at RNIB. So, Preeti, can I hand over to you? And once you start presenting, we'll make sure you're spotlighted. And just a reminder to everyone, we'll go to Q&A after the presentation. So if you do have a question, you can always put it in the chat, but you can always put your hand up or just unmute after we've done the presentation. So Preeti, over to you. And thank
Thank you,
you.
Bhavini, and thank you to you and to Thomas Parkinson Trust for inviting me to talk to everybody. My name's Preeti Singla. By profession, I'm an optometrist. I work in the hospital and I specialise in low vision clinics and glaucoma clinics. I'm also the optometry and low vision engagement manager at the RNIB, where I've been working for a number of years now to help support and train optometrists in community and in hospital to further support their patients with sight loss in making sure that they can receive the appropriate support and care that's out there for them. So this talk that I've been asked to do today is about managing glare and light sensitivity and how to protect your eyes against UV damage. So first of all, I just wanted to talk a little bit about what is UV light. I think that's a very common question that people have. When we talk about light, light comes in different wavelengths. It's all part of the electromagnetic spectrum. And what we see is visible light. But there are other types of light that we have to be careful of, which all travel at the same speed as visible light, but we can't see them. And some of these lights can be quite dangerous to us, and they can cause eye conditions and skin conditions and all sorts of other things. And so the main part of this that we need to be concerned about or be careful of is UV light. So you often hear people talking about that. And this is the one that we say when you're buying sunglasses or you're buying sunblock. So the sun protection factor, this is the type of light or radiation that we are trying to reduce. So it's UV light. So it's a form of non-ionizing radiation, and it's emitted by the sun and by artificial sources such as tanning beds and lasers. UV light is not all bad. It has a lot of benefits as well. And one of that is production of a vital nutrient called vitamin D. So it's really important that we do get sun exposure and we don't hide away from it and we get the vitamin D, but that we protect ourselves from the more dangerous types of the rays. And I'll tell you a number of ways you can do this for your eyes and some of the problems that UV light may cause to your eyes. So as I said, overexposure may present risks to the health and the eyes, and so protection is very important. I am going through everything on these slides, so don't worry. And I think Bhavini's got a Word version of it that she can share if anyone's interested.
Yeah.
So to explain a little bit more about UV light, we call it all UV radiation or UV light, but there are different parts of that. So we have UVA, which is the longest wavelength of this light, and 95% of the UV that reaches the Earth's surface. This is the 95% of the UV light that reaches the Earth's surface. And this, when we talk about health and the damage it can cause, this type of UV light can be linked with cataracts that we get in our eyes and also with skin damage. This is not if you get a little bit of exposure, but this is long-term exposure, unprotected exposure. So if your eyes are not protected and your skin is not protected, long-term exposure can cause these problems. So it's nothing that we need to panic about if we go out once or twice in the light, or if up till now you haven't been using the right protection, but it's definitely something that you can do to protect yourself going forward. There's another type of UV light, which is UVB. So this is medium wavelength. And for anyone that's interested, this is 280 to 350 nanometers for the physicists of you that like the technical information. This type of light is responsible for skin burn. So when we go out in the sun and we get burnt, that's not the visible light that's causing that. That's the UV light. So even on a cloudy day, we still have lots of UV exposure, which is why it's often important to protect your eyes even in those days, or protect your skin more, not your eyes as much, but your skin for the cloudy days. And this can also, so can cause skin burns and skin cancer. It can also damage layers of the front of the eye and the lens in the eye. So this can damage the cornea, which is the front window of the eye, the transparent window. And it can also damage the lens and cause cataracts, as we talked about. And then we've got UVC, which is the shortest wavelength of light, but not much of this comes down onto the Earth's atmosphere. Most of it is blocked, so we don't worry as much about that one. So that's just a little bit of the technical side of UV light, but you don't have to know all you need to know is some parts of the UV light can be dangerous and what can we do to protect ourselves. So UV damage, as I said, it can come from sunlight, not just direct sunlight, also reflected sunlight. So from snow or from water can also damage your eyes. Tanning lamps, so sunbeds can cause damage. If anyone's ever used one, you'll know that they give you the little goggles to wear to protect your eyes. UV lamps and welding arcs, so for people involved in those kind of industries, they are at risk and they should be wearing the right sun protection as well. The reflected UV, as I said, can come from snow and water and also from glass and from concrete. So you do have to be quite mindful of any reflected light as well, or reflections. We always worry about our skin with UV light, and people are very good at wearing sun protection and sitting under an umbrella because we worry about our skin. But actually, our eyes are 10 times more sensitive to UV than the skin is. And it's often forgotten that we should protect those too. Particularly for children, we often forget that children also need protection from this. And actually protecting children's eyes at a young age can help prevent from the damage that UV light can cause later on in life as well. Children have very large pupils compared to adults, and they have clear lenses, and they also spend a lot of time outdoors compared to grown-ups, which means that they often absorb up to 70% more UV light than adults do. And I've just got on here again, which I've mentioned before, that reflected UV is just as harmful. So what eye problems can UV exposure cause? So on the cornea, which is the front window of the eye, it can cause something called photokeratitis. And this is where you get inflammation of this front window of the eye and almost like an extreme dry eye. But rather than feeling dry, your eyes often water a lot more. And sometimes when you have exposure to UV and you get this photokeratitis, you don't get the symptoms straight away. They're often a bit of a time delay. So you might be, let's say you're on a ski slope or somewhere or out in the mountains walking and you didn't have the right eye protection on and you were exposed to the sunlight there and the UV light there. You wouldn't notice it straight away, but the next day you might get some symptoms. So you'd get very red eyes, watery eyes, stinging eyes, and this can be photokeratitis. It's treated. So, lubricants, padding, a healthcare, eye care professional will be able to treat that, but those are the kind of symptoms. It doesn't normally cause long-term effects. Get solar retinopathy, where you get damage to the retina at the back of the eye from looking at the sun. And this is why when we have eclipses, solar eclipse, you're not meant to look at the sun straight directly on. You have to look through a camera or a pinhole camera or a piece of card that you can cut a hole in. It can also increase our risk for age-related macular degeneration, which is a condition where you get damage to the retina, again, the back surface of the eye. But the macula is a special part of the retina that sees all our detailed vision. So it's one of the most important parts of the retina. When you look at a book or a screen, that image forms on your retina and it's what gives you that fine detail. And macular degeneration is when that part of the retina is damaged. We can treat some types of macular degeneration, but some types we can't. Cataracts, as we talked about, you may know what cataracts are. You may have heard about cataracts already. So cataracts are where the lens in your eye, which focuses the light, almost like a lens in a camera, is normally clear when we are younger and lets all the light through to create sharp images. Sometimes we need glasses to help focus the image a little bit more, but we can still get a clear image if the lens is clear. But over time, UV light exposure can cause cataracts, which is when the lens in your eye becomes foggy or yellow, and it can change the color, the way you see colors, or how blurry, it makes things more blurry than they used to be, and glasses can't help improve this, so you need to have the cataracts removed. You can get something called basal cell carcinomas, which are a little localized cancer on the eyelid itself, and they are like a little scab that bleeds. And it's important that you get things like that checked straight away, because they can be treated very easily and quickly if we pick up on them. And pterygium. So pterygium is where you get like a cling film tissue grow in the corner of your eye near your nose. And it can obstruct the iris, or what looks like the iris. It actually grows over the cornea, the window of your eye, but it looks like it's coming in front of the colored part of your eye, which is called the iris. And it often happens if you've lived in a hot country, even when you were younger. If you don't live in a hot country now, but you grew up somewhere like South Africa or Australia or India, places like that, often people get something called pterygium. We don't normally treat pterygium unless it's causing a lot of symptoms or it's growing in front of the vision, the part of your eye where you see clearly through the pupil, the window of the eye. And in which case it can be removed if need be, but often we just leave these as they are, and because they don't cause any visual problems. So these are just some of the problems can be caused by UV light. So that's a little summary of UV and the damage it can cause. But when we talk about glare, so when you go out and you have problems with glare from light, that's the visible part of light that's causing that, not the UV part of the light. And you can often have a number of eye conditions, or if you're on certain medications or you have certain health conditions that cause changes in your eyes, which means the light, rather than going directly through your eye onto the retina to produce a clearer image, it can scatter once it goes in your eye, and it can make your eyes more sensitive to the light. It can give you a number of symptoms. So it may be that in front of you things look veiled or like in a silhouette or like shadowed. Or it might be that when you go from one light level to another, your eyes take a bit longer to adapt than they should normally. Or it might be that you get discomfort in your eyes and your eyes might water or feel sore, or you can't open your eyes properly because of the glare that you're experiencing. There are a number of eye conditions that can cause glare and light sensitivity. I'll name a few of them and tell you a little bit about what they are. But there are many eye conditions can cause light sensitivity. So there's some that you can get from birth, which is called a columboma, and they affect the development of your eye, where the structures don't develop properly. I won't go into too much detail on these because obviously they're more relevant for the people that are affected by them, but I would be happy to answer any questions, or for Bhavini to pass on my email address to anybody that's got any questions. Again, ocular albinism is similar. It's when the pigmented part of your eye, it doesn't develop properly and you let more light through to your eye. Similar to aniridia, that's again when the pigmented part of your eye doesn't develop properly. Cataracts, as we talked about before, they can scatter the light that comes into your eye and make things look blurry. You can get dazzle and glare when you have headlights in front of you or street lights in front of you. Macular degeneration, which we talked about before, can cause glare and light sensitivity. Uveitis is a very common eye condition that's linked with lots of other eye conditions. So you can have uveitis on its own as well as with other eye conditions. And it's where you get inflammation inside your eye, in the jelly of your eye. And that inflammation can cause light to be scattered. There are a number of inherited conditions in the eye of the retina, the back layer, the light sensitive layer at the back of your eye, called the retina, that can cause light sensitivity, such as retinitis pigmentosa. You might have heard of that one. That's where some of the cells in your retina don't work quite as they normally should, and you can get loss of your certain parts of your vision. We talked about the cornea, the front window of your eye, and you can get dystrophies where you get damage to this window, and that can scatter the light. We have glaucoma, which is one of the more common conditions of the eye, where you get damage to the nerve in the eye, and that can cause light sensitivity. And keratoconus, again, which is a condition that affects the cornea, the front window of your eye, and it causes it to be a different shape. Normally it's like a curved shape, the cornea, but it can become more pointy, like a cone shape, and that can make the light scatter in your eye as well. There are others as well that I haven't talked about, but these are the more common ones. There are two types of glare that you can get. So there's a discomfort glare, which the dazzle that you get from the light coming into your eye doesn't affect your ability to see things. You can still see them, but your eyes do feel sore and uncomfortable. And it's much more difficult to manage for a longer period of time. It can also cause your eyes to cause you to get headaches from looking at it. And then we've got the other type of glare, which is the disability glare. And this is when the light comes in your eyes and causes dazzle, and it actually reduces the contrast and affects how much detail you can see of things. So it makes you not be able to see things as easily against their background. So things blend into their background. And this is often described as a whiteout effect. So everything looks the same and you can't see an item clearly against the background that it's on. So that's disability glare. So going about what we can do about these things, the UV light, the glare, what we can do about them. Actually, going back just for a moment about the types of glare. So there are a few things that can cause glare in particular. So headlights are one of the most common causes of glare. So if you're driving or if you're a passenger in a car, you can still get the same problem. And over the years, more recently, they've changed the type of lights they use in car headlights. Because they last longer, the bulbs last longer, they go further so you can see further, but actually they cause more glare in your eyes as well. So we do need to be mindful of this. Any lights that are shined directly in your eye, so if you're in a room and the light source is shining directly in your eye, that can cause dazzle and glare. Or when the sun is setting and the sun is low in the sky, so dusk is a particularly difficult time for glare and dazzle, as well as you get a glimpse of sunlight through trees. If you're driving through an area that's got a lot of trees, that can cause a lot of dazzle and glare as well. So yes, going back now, how I said how you can protect your eyes. So protecting your eyes from the UV light first. So you've got to remember that a dark tint, you might think, oh, it's a dark tint that will protect your eyes. Yes, a dark tint can make your eyes feel better and let you see a little bit better or improve the contrast, but you have to make sure it's also protecting your eyes from UV light, because they are different things. So you have to make sure the sunglasses are marked or they are appropriate to the guidelines that we have. So all glasses should have UV 400 blockers. So that covers all the UV light, the A, the B, and the C. And they should be marked with a CE mark, which fits with European guidelines. We also have British standards, so they can have British standards on them. So for non-prescription sunglasses, there's a certain British standard that will be written on it. That's a non-prescription sunglasses are the ones that you buy off the shelf in the pharmacy or in the shops that don't have any power in them or any number in them. They're for everybody. Or if you get prescription sunglasses made, probably through your optometrist or your optician, but some people do buy these online now, so you have to be a bit more careful. They should also have a British standard number. There are different numbers for whether they're a prescription sunglass or a non-prescription sunglass, but you don't need to concern yourself too much about that. They just have to have BSEN. That is the British standard. That shows that it's a British standard and it conforms to the regulations. So which color is best? Bhavini mentioned this in the introduction. This is really difficult, and there are guidelines that say for certain eye conditions, certain colors work, and I will go through that a little bit. But actually, it's really individual, and when I get patients come in and I show them the glare filters that we have and I use the guidelines, and actually I may, according to the eye condition they have and the type of glare they have, I may think a yellow or an orange will be perfect. And actually they don't, they prefer the gray or the black. And so it's okay as a starting point, but don't tie yourself to it. If it's not working for you, it's okay to choose a different color or to try a different color. So what you should do is choose the color and depth of tint that you find helpful for the activity that you're doing and the light conditions that you're doing it in. So, you know, dark tint may block out as much light as possible. But you've got to remember, if you're doing it somewhere where it's dimmer lighting or indoors or things like that, it will be different than if you're doing it outdoors. So you do have to, and so you may want to consider different levels of tint for different activities that you're doing and different times of day. Sometimes people might recommend a photochromic lens that changes with the different light levels. These can be good, and I think they're better than they used to be. But you do have to remember that they are affected by UV light more than by visible light. So sometimes it might be a cloudy day, but there's a lot of UV light, so it might darken too much for what you need for the visible light. So you do have to be a little bit careful. You lose some control with the photochromic lens. And also they do take time to change color, so you have to be aware of that. The rules are, on the whole, yellow or orange or brown block out blue light, and they can help contrast for people who have cataracts or inflammation in the eye. But as I said, it doesn't always follow this. Grey, on the whole, reduces all light levels, not just the blue light. And it, on the whole, makes what you're looking at similar colours to what it should be. So it doesn't affect what we call the color rendering. So the types of colors you see, it just blocks all the light in general. Whereas because the yellow, orange, and brown block just the blue light, when you're looking at something, it does change what you're seeing a little bit, and your light perception. I mentioned about the photochromic lenses. It mentions it here again. They are good if you don't want to keep changing glasses, but they're not so good for people and they're also not so good for people who have low vision, because you can't make them in a wraparound form, the photochromic lenses. And wraparound glasses can be really useful for blocking glare at the sides of your vision. Polarized lenses. So you can get lenses which are polarized, and they block light in different directions, and that can really help with reflected light glare. So if you like sailing a lot and you're on a boat a lot, or fishing, those kind of things, polarized lenses can be really useful. They can reduce glare. So glare shields are usually the wraparound tinted glasses that you'll get if you go to a low vision clinic or an optometrist. They can often be called eye shields as well, so that it is interchangeable. But an eye shield is often the shields that you get after you've had an operation or something. So the ones that they stick on temporarily. Is glare shields are the ones that wrap around. You can get these in fit, what we call fit overs. So they're a larger shape, and they've got side filters as well, and they can go over your prescription glasses that you have, so they can be really useful. You can't normally get a prescription put into them, so you get ones that you can just wear as they are, or which fit perfectly, or you can get larger ones that can go over your existing glasses. The advantage with those is you could just put them on when you need them, and they block the light in all directions. Then we often use the term sunglasses, which are the normal fashion glasses that you think of. They don't tend to wrap around. They're just the normal glasses, although you can get some sports sunglasses that do wrap around a little bit, but they can't go over your normal glasses. So when deciding what types of so if you wanted to buy, I'll go through this a little bit more, but if you wanted to get a glare shield or a fit over glass or something like that, you'll need to do that with a professional. They'll be able to advise you best, and I'll tell you who you can go speak to about that in a moment. But if you wanted to get sunglasses yourself, you can get those from anywhere, obviously. Sometimes you can get wraparound ones, but often the wraparound bit doesn't have the filter in if you're buying them from the chemist or the shop. The wraparound bit at the edge often just is black, it's blocked out. So you have to be a bit careful there. They can reduce your navigational vision. But when you're choosing sunglasses, ask yourself, are they suitable for the purpose that you're using them for? Do you need them to go over your normal glasses, in which case that may not work because it won't fit on your nose bridge, it may not be big enough. Do they fit the contours of your head? Do they wrap around properly? Because you have to remember that sunlight can come from all different directions, not just straight on. It can come from above, it can come from the side, and it can also be reflected from the ground. But if you want to get glare filters and have them appropriately assessed for you, that's normally the advisable thing to do. So the best thing to do for that, you can buy them online, but I would be a little bit careful because it's a bit more complicated. But you can go and see a professional. So your optometrist in a low vision clinic or even in community practice in the high street should be able to advise you appropriately on this. The sensory team, your local sensory team working for the sensory service can help you with this, so rehabilitation workers. A low vision practitioner, these may be based in the hospital, in the charity, or at your local optician as well. They tend to be optometrists or other eye care professionals like orthoptists who have a special interest in low vision itself. You can also get glare filters from a lot of local charities. They have resource centres and they can have some that you can try on and have a look at. And they will also have people working there that will know a bit more about it and can advise you. So this can be helpful. But what else can help? So apart from glare filters and sunglasses, there are other things that you can do. So wearing a hat with a brim can reduce a lot of glare and sunlight and visible light that comes particularly from above. You can get sports visors, so they're like a sun cap or a baseball cap, but without the bit that goes over your head, so they're just a visor. You can use something called typoscopes. They protect light being reflected off the paper, so sometimes you can get a lot of glare on a piece of paper, particularly white paper, when you're trying to read something. And a typoscope is a normally black card that has a little letterbox window that just shows you the line that you're reading, and you can move it across and move it down depending on what size it is, and that reduces the glare from the rest of the page. One really useful tip when you're using glare filters or sunglasses and you're going outside into the sunlight is they don't work straight away. So your eyes still take time to adapt to the sunlight. So it's often useful to put them on when you're indoors just before you go outside. And then you'll find it easier to adapt when you go outside into the light. There's a number of resources here that I've got, which will be on the Word version of this talk that Bhavini can send around to everybody. So there's links to the RNIB pages, which give more information on light sensitivity and how to protect your eyes from glare and UV. We've got links to the Macular Society. There's some links on protecting your eyes from the sun and how to get the right glasses for you. And I think that's the end. So I will hand back to Bhavini and for any questions that you may have.
Thank you, Preeti. That was extremely useful. I mean, even I've learned so much, and the tip you shared about wearing your sunglasses indoors before heading out. Absolutely. I think that was the biggest tip anyone ever shared with me. I think it was my rehab officer who shared that. And I totally swear by that. So thank you so much. Before we move over to the Q&A bit, I just wanted to share the details of our next webinar, I Care and You webinar 26, which will be taking place on Tuesday, the 9th of July at the same time of 7 p.m. And the focus on that webinar is all about cataract. So learning what a cataract is, how it develops, when it's possible, when your professional consultant or optometrist advises when it's safe to operate on them and when it's not. So it's all about cataract. So we'll share the link information for anyone who wishes to join that webinar.